cancer. By cancer, they are the cells rapidly growing. And normally cells are at one place in the body and they're doing their task, what they have to do. These cancer cells are not doing that. They are rapidly growing and also spreading, going to other places. They can invade other tissues, growing over the tissue about to be invasive, having malignancy, then be invasive to besides to other organs, or spread over the lymph and blood vessel system to other places in the human body. And they are a waste of things in the human body, and over time they lead to death if treatment isn't successful. And some other things general about cancer. Every second person statistically gets cancer in their lifetime, and the older the person gets, the more likely is it that they get cancer. Some cancers also have children, like leukemia, cancer of the blood, or cancer of brain or bones. Men and women have cancer overall equally. There are some cancers which women more have or men more have. And also some causes are named here, what cancer can cause. There is said in this book from the 80s, from 1982, that there are some suspicions towards some chemicals, maybe in the food, in the air, and the water. Some people who work with such chemicals might get more likely cancer. And then there's also said cancer is not hereditary. There are some things which make it more likely that some children get it more likely, but it is not hereditary. And there are some viruses which might cause leukemia or neck cancer, but in general, not so much. The main thing is cancer is not infectious. So there are some viruses which can cause cancer, but cancer itself is not infectious. And then we have studied something to the terminology. They said neoplasm, that is just the growth of new cells, which are useless. And tumor is it when it's bigger, to be felt or seen. And carcinoma are the cancers called of the tubes of the gut of the bronchi. And sarcoma are the cancers of the connective tissue, of the muscles, bones, ligaments. And they can have malignancy, that means that they are invasive to other places. And they can be malignant or benign. And malignant means that they are doing that invasive stuff, and benign means they're doing that not. But some benign can turn malign, so they're sometimes removed when they are benign. What symptoms do they cause? A bunch of symptoms. Cancer oftentimes just causes symptoms as soon as it is advanced to be destructive. And there are some general symptoms like loss of appetite, some fatigue, some mood changes, and weight changes, but also some other things like blood or mucus in the feces or in the urine, or other things. And now what can be done against it? Now the first important thing is the earlier the better. The earlier the cancer is found and treatment is started, better. Now what can be done? There is the idea of surgery, then it is just cut it out, maybe then in combination with radio or chemotherapy. So cutting it out, surgical, is an option. Another option is to make a radiotherapy. Cancer cells are more susceptible to X-rays, and therefore they're getting more. And also chemotherapy, where also these medications or whatever they are more infectious, more stronger going onto the cancer cells than on other cells. And how is it found out? They can be made X-rays, they can be swallowed a dye, which is then taken in stronger by the cancerous cells as the other ones, and then it can be seen on the X-rays or something. And other things, they can be made biopsy of the cancer itself, have things taken out and then looked under a microscope under it. And they can be looked into little specks of blood in the feces. They can be made then tests of a cervical smear for cancer at the neck of a womb, or testing the urine, or other things. And this is what your written is. And they are basically ending with advising with if in doubt, find it out. So they're saying the earlier it is found, the better. And if someone is doubting that maybe a mole is turning cancerous or some things or something like that, if in doubt, find it out, do they say. And early finding, screenings, checking for some things regularly might help to find it earlier and to have it earlier. And they're also saying that, and that already in the 1980s, that they are working on treatments and that they're making advantages to be able to cure and treat more and more cancers. So, and that is all according to the Reader's Digest Family Medical Advisor written by Keith Hodkins in the year 1982 on the pages 106, 107, and 108. But this is no substitute for medical knowledge and also no medical advice. Hi, welcome. I'm trying to learn oncology. Today, cancer, and after we've done that, we're going to do extensor carpi ulnaris strength training. And if you participate in extensor carpi ulnaris strength training with this at your own risk, we're talking about cancer and so on. And this is no medical advice. I'm just trying to read and to understand it. And this is part 5 or something. And we had so far, we're preparing a presentation to be able to say the most of these things in a little presentation from memory. We had so far that cancer, these are cells which are growing out of the ordinary. They're having fast reproduction, and they are total waste of energy, would someone say. Normally cells have a role and a duty in the human body, but here they are just growing uncontrolled. They multiply rapidly. And that forms when swelling. Normally cells are just in one part of the body growing, but these cancer cells, they just grow on through the borders of the organ beyond and invade the other one. And that is called, they can also go into the blood lymph system and then spread to other places in the body, to other organs. That is called metastasing, and these things, when there these cancers, are called metastases. And around every second person gets it. It gets more likely if the person gets older. There are also cancers like leukemia, the renal bone cancer, which is developed in children. And men and women are equally affected. There are some types of cancer which men will have, and some types of cancer which women will have. Causes of cancer are here named a few, and it is the third reason of death after heart strokes. In Western countries such as Britain and America, the book is from the 1980s, the beginning of the 1980s, 1982, I think. In Western countries such as Britain and America, 1 in 4 deaths will be from cancer, while 2 in 4 will be from heart diseases and strokes, and 1 in 4 from other diseases. Okay, a quarter do they say, and a quarter from something else, and half of heart and stroke disease. Now, reasons for it. It is not inherited. There are for some types, there are some predispositions for some types, but cancer overall is not inherited. And another idea where cancer can come from are people working with chemicals in their occupation. Or also an idea is that there might be some chemicals, maybe in the food or in the air in cities or next to factories, or yes, in food, in water, in the air, that there might be some things in which could cause cancer. When cigarette smoking is something said here, is something the medical world agrees on, that is linked to lung cancer. Cancer is not transmittable to other people. It is not inherited and not transmittable to other people. It's not infectious. And okay, then we're having neoplasm just means new growth of useless cells, and tumor is when a lumpy collection of tissue cells large enough to be seen or felt. Malignancy refers to the chaotic cell growth and invasion and destruction of nearby tissues. Tumors and neoplasms can be malignant, so cancerous, or benign, which is non-cancerous. Some benign can turn malign, and therefore some of them are removed, precautionary. And cancer from the lining tubes are called carcinoma, and from fibrous tissue, muscles, ligaments, bones, sarcoma. And then symptoms and signs. I don't know if they are pretty graphic here, if it is helpful to name them. If these symptoms are, the person should see a doctor, whatever it is, what we're talking about. Maybe the other one here. Pain, jaundice, extreme changes of mood and mental attitude, epileptic type, fits, loss of appetite, loss of weight, abruptly undue amount of tiredness, So these would be the symptoms which are not so directly seen. Maybe the other one are more graphic. So maybe I said it in the last part. Maybe we're not going to use them at all. Maybe we're not going to talk about the symptoms, just about cancer. So how it is detected and examined, and if a person, they can be made a biopsy, so it can be checked the urine and the sputum. It can make a cervical smear of the neck of the womb. It can make an X-ray can be taken, and there are also some radioactive drugs with a dye, which are then shown up on an X-ray. Okay, these are these things. And available forms of treatment. So there's a new, we haven't read onto that. The aim of medical treatment is to remove or destroy the primary site of the cancer before it spreads to other sites. Okay, medical treatment, remove or destroy. Because the exact nature and causes of cancer are unknown, there is no single group of effective drugs that can be used against it. As for example, antibiotics in the treatment of infection. Treatments for cancer are still rather crude in their attacks on the growth. They are surgical removal, so cutting it out, and also adjacent tissue. And the lymph glands which the growth may have spread. I want to know more about that. The spreading to the lymph glands. We did in medicine, in our series, a part of oncology, did we do breast cancer. Why is it going up to the lymphs in the armpits? The surgeon can see and feel the bulky tumor. Okay, he or she can only hope to remove the growth before any larger scale spreading occurs, and then to kill off any few remaining cells by radiotherapy or chemotherapy. The results of surgery are generally good. Okay, if it is surgical, then it is not completely clear if it was removed before it has spread. And after that, maybe radio and chemotherapy is done to destroy the ones which might have spread. Then radiotherapy is a form of treatment. So it was surgical, so cutting it out. And maybe additional radio and chemotherapy to destroy it if it has spread. Here, cutting out is possible by breast, bowel, lung, kidney, test, womb, ovary, bones, and skin. It cannot be done within the brain. So X-rays and other forms of radioactivity are used to destroy cancer cells and leave normal cells undamaged. The treatment is based on the fact that abnormal and rapidly growing cancer cells are susceptible to low levels of radioactivity and normal, more stable cells are not. So radioactivity, radiotherapy, the cell is more susceptible to the radioactivity as the other cells. In some extensive cases of skin or breast cancer, radiotherapy may be the only practical treatment. It may also be used as a follow-up to surgery or chemotherapy. The treatment requires precise calculations and expertise in the use of potentially dangerous radiotherapy machines. Radiotherapy, the reason is that the cancer cells are more susceptible for the radioactivity as the other cells. Chemotherapy. There are certain drugs that destroy cancer cells without damaging normal cells. They are called cytotoxics. Excessive dosages, however, will also destroy normal cells and kill the patient. And so the drugs which are taken in capsules formed by mouth or by injection or drips must be employed with great care. Cytotoxics have been dramatically successful in curing cancers such as Hodgkin disease, which mainly affects lymph nodes and spleen, some forms of leukemia, and certain rare cancers of the male and female genitals. Even when a complete cure has not been possible, they have been helpful in relieving pain and other distressing symptoms. Chemotherapy. There are cytotoxics taken. We say it as we have it here. I'm not sure if it is enough. It is not enough for a presentation about chemotherapy. I think there's more to chemotherapy. But we're having a presentation about cancer, and we're going to say what we're saying. We're going to say it's from the 80s and out of this book. So we have what we have. We have chemotherapy. These are cytotoxic capsules which are taken and they are destroying the cancer cells more likely. It's the same as the radiotherapy. The cancer cells more likely as the other cells. Then is here written naturopathy, in which no drugs at all are used and cures are based upon diet and exercise, or faith healing, in which illness are cured by the power of suggestion, or treated with minute dose of drugs that in a healthy person would produce symptoms similar to those of a disease, homeopathy. Quote, despite occasional reports of miracle cures, not be a repeatable form of treatment for other cases. And where success has not been proved by scientifically organized trials. So I was saying, homeopathy, I don't understand what it is, in which a disease is treated with minute doses of drugs that in a healthy person would produce symptoms similar to those of a disease. Okay, I have an idea. What the idea behind homeopathy is. The person is made sick in the way as it would be, and then the human body would react against it, but we are reacting now against the capsules, which were strong enough, or against the thing which we are taking. It's just an idea. I'm just trying to understand what is it even? Homeopathy is. So I think the idea is, we are taking something which makes them sick, like against against the flu or something. And now the human body is able to go against the thing taken, which made them sick. And the idea is maybe that it attacks now both. Not just the illness gotten through the thing taken, but also the illness from the cancer. I think that is the idea. But I have no idea. Okay, they're saying homeopathy, so taking a capsule which produces an illness. And I think the idea is then that it does not only, the body is not fighting only against this illness coming from this taken thing, but also against the illness through the cancer or something. Or just neuropathy, so just trying to live as healthy as possible with exercising and diet, or faith healing through power of suggestion, I think I mean praying, are not scientifically proven that they are repeatable, effective. On rare occasions, the body overcomes and destroys cancer without medical help. Most doctors have experienced such all the time. Have experienced such, let's do this to the end, such inexplicable phenomenon at least once in their careers, and it reinforces the growing view that cancer, though still a deadly affliction, is not the unbeatable opponent it was once thought to be. So we're saying that there are cancers which are beatable, and even some which have, without any medical help, got away. That gives many people the hope that cancer is actually not as it once thought, what was it called, a death sentence, that it can be cured. And 30% are already curable in the 80s, he said. Now, that was the oncology part. If you were here for oncology, when it was no medical advice, if you go to the next part, you're going to go there and we're going to participate. We're going to continue there with reading that and puzzling together our presentation about cancer. If you stay here and participate in the extended couple and our strength training is already on us. Have a good and stable stand, arms up with fists and bring them down. And up. Fists like that, and down, and up. We're having 3 rules. So the first rule is that we're stopping immediately as soon as there's pain. And I'm going to use no sock. You can use also a towel or t-shirt, press onto it, and again down. The second rule is that we're going only as far as we can go with a little bit of up again. And down. And the third rule is that we're not overdoing it. We just want to strengthen, not to exhaust. Alright, press. Up. And press. And to the outside. In again. Press equally with all 5 fingers and go only as far as you can go with a little bit of effort, all painless. In again. And change. Press. In. Out. And press hold up. Down. Up again. The other hand, press, down, and press, over and press, and got moderate pressure over a little bit of low arm. And on the other side, don't think it's necessary. By these exercises. Now, let's pause the extensor couple strength training. I thank you very much and have a good exercise.